Okay. Hello, everybody. Thank you so much for joining this congressional briefing on the universal benefits of school programs that bolster the behavioral health and educational success of our youth. My name is Dr. Diana Fishbein, otherwise known as Denny. I'm at the Frank Porter Graham Child Development Institute at the University of North Carolina. And I also am the co-director of the National Prevention Science Coalition to Improve Lives. So thanks again so much for joining this briefing on the universal benefits of school programs. I'm sure that we all agree that there is nothing more important than providing the support children need to be able to meet their developmental milestones so that they have the greatest chance of being healthy and productive adults. There is no doubt that children do best when they are endowed with strong academic, behavioral, and social skills. Decades of research have led to the development of evidence-informed programs shown to effectively build these competencies. And when individual practices that are components of these programs are offered to children in their schools and at home, they blossom. The research also shows that children who receive these programs and practices have lower rates of mental health problems, violent behavior, substance misuse, and suicide. So it stands to reason that when federal and state educational policies explicitly support these programs, there is potential to benefit an even greater number of our children. Today, we're featuring national experts to talk about this topic. But first, let me tell you who our briefing sponsors are. The National Prevention Science Coalition to Improve Lives is a sponsor of this briefing. Also, Frontier, which is a program at the UNC Frank Porter Graham Child Development Institute, and UNC itself, the FPG Child Development Institute, and also the Penn State Edna Bennett Pierce Prevention Research Center. So we are really delighted that Congresswoman Bonamici agreed to speak in support of the policy relevance of this work. Strengthening public education is one of her top priorities and one of the reasons that she got involved in public service in the first place. She is a leader on the Education and Workforce Committee and a ranking member of Early Childhood, Elementary, and Secondary Education Subcommittee. And she's also been a longtime advocate for equity in education policy and funding. Her focus is on giving students the support and opportunities they need to succeed in school and in life. She played a major role in passing the bipartisan Every Student Succeeds Act, the ESSA, to put more focus on a well-rounded education and to give the states and local districts more decision-making authority. So I will play that video for you now.
Hello, I'm Congresswoman Suzanne Bonamici, and it's an honor to represent Northwest Oregon in the U.S. House of Representatives. Thank you so much to UMC and PSC for organizing this timely and important briefing and for inviting me to speak with you today. This Congress, I have the honor of serving as the top Democrat on the House Education and Workforce Committee's Early Childhood, Elementary, and Secondary Education Subcommittee. When I first ran for Congress, I brought with me several years of experience as a public school parent and advocate, and my passion for public education continues to inform my work to advance policies that support safe, healthy, inclusive, and supportive schools and a well-rounded education for every student. In 2015, I had a key role in passing the Every Student Succeeds Act. The Title IV-A grants in that law play an important role in developing inclusive and supportive schools by helping to expand access to a well-rounded education that includes art, music, humanities, and technology. I've long advocated for more funding for Title IV-A grants, and I'm also pleased that the Bipartisan Safer Communities Act, which President Biden signed into law in the last Congress in the wake of the horrific Robb Elementary School shooting, that includes $1 billion for safe and healthy student programs under Title IV-A, in addition to $1 billion for school improvement and school-based mental health services. As the Department of Education is working on implementing the Bipartisan Safer Communities Act and awarding grant funds to states, I have been closely monitoring the department with the goal that they encourage states and school districts to spend these investments in an equitable and non-punitive way. For schools to be truly safe and supportive learning environments, we must continue to support evidence-based investment in school counselors, psychologists, social workers, racially and culturally responsible curriculum, culturally responsive curriculum and social and emotional learning, restorative and non-exclusionary discipline, and whole child learning. These investments we make toward creating safer, more nurturing, and more supportive schools are a direct reflection of our values and priorities. Particularly in this moment, we must provide significant academic and instructional support to students and educators, as well as wraparound services for families. Pandemic disruptions resulted in missed learning and highlighted longstanding inequalities in our public education system. State legislatures continue to introduce and pass bills that micromanage classroom teachers, whitewash curricula, curtail free speech, and police the bodies of students. Data, most recently from the CDC, show that students are struggling with mental health challenges at record rates for various reasons, including the effects of the pandemic, isolation, gun violence, and the effect of discrimination based on their race, disability status, or sexual orientation or gender identity. Teachers are leaving the workforce amid burnout and unrelenting demands. As we confront these challenges in public education, we must emphasize evidence-based programs that are designed to promote the academic, social, and behavioral development of children in public schools. Earlier this year, I introduced bipartisan legislation with my Republican colleague from Pennsylvania, Representative Brian Fitzpatrick, to leverage the federal government's resources to support the mental health of educators and support staff. Our legislation, the Supporting the Mental Health of Educators and Staff Act, recognizes the reality of teacher burnout, and it provides federal funding for evidence-based solutions to equip school and district leaders with resources and knowledge to boost teacher morale and improve retention. Educators already face the monumental task of helping students recover academically post-COVID-19. And equitable and sustained recovery depends on educators performing at their best. And for educators to perform at their best, they need access to meaningful structural supports for their mental health. I also work with a broad range of organizations representing students, parents, and educators from diverse communities to develop a Bill of Rights for students and parents that presents a vision of public education that is inclusive and affirming. My Bill of Rights is built on 5 pillars. 1, a well-rounded education. All students should be able to receive a well-rounded education that provides them with knowledge and skills they need to be successful. Number 2, authentic parent involvement. Parents and families, including those from diverse backgrounds, should feel welcome and be able to collaborate effectively and work in close partnership with their children's educators toward the improvement of our public schools. Number 3, responsive and inclusive public schools. Public schools should be places where students and educators are supported and feel supported, and where students receive the care and counseling they need. Number 4, student civil rights. All students should be able to learn in environments where they can be their full selves and remain free from all forms of discrimination, including discrimination based on their actual and perceived identity. Finally, education and democracy. Public schools are critical to the building of a multiracial, multi-ethnic, diverse, and inclusive democracy. All students should be able to receive an education that is historically accurate, that reflects the diversity of our nation, that prepares students to think critically and participate in a representative democracy. Hostile and unsafe learning environments are antithetical to the tenets of social and emotional learning. Classrooms should and must be safe places where students feel comfortable and supported in their journey to becoming responsible and empathetic citizens. Public education stands at a crossroads. The work of institutions and organizations like UMC and NPSC Your work is crucial to guiding legislators in the right direction for schools, for educators, students, families, for leveraging the power of research to inform education policy. So thank you again for your work and for inviting me to speak. I hope you enjoy the rest. Hello, I'm Congresswoman.
Oops. Thank you so much, Congresswoman Bonamici. That was excellent. So I'm going to begin to just introduce our speakers very quickly. And then as they each begin to speak, I will give you a little bit more background. As our keynote, we have Dr. Aaliyah Samuel, President and CEO at Collaborative for Academic, Social, and Emotional Learning. And then for our expert testimonies, we have Dr. Catherine Bradshaw from the University of Virginia. We have Dr. Dorothy Espelage at the University of North Carolina. And we have Dr. Mark Van Ryzen at the University of Oregon. And for our discussant, we have Lakeisha Steele, who's the Vice President of Policy at Castle. Now, just a couple of words about, housekeeping. Only the panelists will see comments submitted to the chat. So the community of people that are in this briefing today will not be able to see what you submit. Only the panelists will. However, with so many hundreds of people on this, we won't be able to monitor the chat. We will keep it for our records and compile any resources or other materials that are submitted to the chat for consideration later. If you have questions for the panelists, please submit those questions to the Q&A, and we'll address as many of them as possible at the end of the briefing. And then about a week after this briefing, the entire event will be on our website, that first website that you see there at mpscoalition.org, and you'll be able to re-review it or share it with others. So with that, I'm going to stop my share, and I'm going to introduce our keynote speaker. Dr. Samuel is a bilingual executive leader with expertise from early childhood through higher education. She previously served as Deputy Assistant Secretary, Local, State, and National Engagement at the U.S. Department of Education, as a Senior Fellow at the Center on the Developing Child at Harvard University, and former Executive President of Government Affairs and Partnerships at NWEA. Prior to that, Dr. Samuel was the Director of Education at the National Governors Association. Dr. Samuel, will you do us the honor, please?
Good afternoon, everyone, and good morning for some. It really is a pleasure to be here with you today. I first, before I go into the conversation, I want us to just stop and center ourselves on our why. Why are we doing this? Why are we having this conversation? And so I'd like us to think about a young person that is in your life and think about, what do you hope they are able to do, or what are your hopes for them 10 years from now? And I just want to stop and have us take a moment and think about not only that young person, but that question of what are the hopes you have for them 10 years from now? And I'll just give us a moment. So as you're all thinking, I'd like for us to just go to the next slide, and I'd like to share with you two young people in my own life that I really think about on a daily basis. I'm a proud mom of two sons, and as I think about my boys and even what future in life I want for them, is one, to really be able to contribute whatever they're supposed to do in the world. And so I think about, what are the skills that they need? And I think about the curiosity, developing a love for learning. I think about them being able to have jobs that, have really good benefits, and they can have a stable life. And so as I think about these tenets of social emotional learning, it's not only critical as a parent, but I was also a former educator. I started my career as a special education education teacher and went on to be an assistant principal and principal, and seeing the importance of social emotional learning every day in the classroom and as a site-based leader and the impacts on the school community, but also individuals as well and what the classroom looks like. If we go to the next slide, I would like to share a little bit about our wheel. You may be familiar with Castle's framework. This framework really represents how young people develop these important life skills through classrooms, schools, homes, and communities. And I think it's very important to note that Castle's role is we are not program providers. We are a nonprofit organization that focused and coined the phrase social emotional learning almost 30 years ago. And I appreciated hearing Representative Bonamici talk about how important parents are. And I want to underscore that the role of parents has always, and not just parents, but families and caregivers, has always been central to the work of social emotional learning, because we recognize and full firsthand that parents and caregivers are kids' first teachers. And so we have to honor parents and families and caregivers. And we can't think about social emotional learning in isolation. We have to really look at it at various levels, from the classroom to the school to the communities. And so I think this, it's important to note this framework. And then also our five competencies, and you might hear them discussed in different ways, or different competencies or skills highlighted. And so I think it's important to just take a moment to unpack those 5 competencies just a little bit more. I'd like to go to the next slide and talk a little bit about self-awareness and what does it really mean? And when we talk about self-awareness, it's really the ability not only to understand your own emotions, thoughts, and values, but how does it influence or impact other people? And so having an understanding of who you are as an individual, what makes you unique, including your interests, your goals, your strengths, your weaknesses, and how to really integrate that self-awareness in a meaningful way. I'm actually here at a conference, and it was interesting. I had an opportunity to hear Jane Fonda and Bill Gates speak, and both of them talked about how once they were clear on who they are and how they could contribute to the world, that's really when they felt a sense of wholeness and their careers took off. And so I think it's important to also showcase just different examples of when we say understand who you are. I think Bill Gates talked about math and how he always had a mathematical mind. And once he got confident in that ability, he really honed it in and made an amazing living off of his skills. Jane Fonda talked about her passion for environment and being outside in nature. And once she understood that, how that really made her an advocate for protecting our environment. And so this self-awareness is really important because it is how we help to contribute to the world. If we go to the next slide, which is self-management, this is where we talk about how do we manage those emotions and thoughts and behaviors, and in different situations to be able to achieve those goals and those aspirations that we have. And, you know, I think about, for us getting ready for the webinar, there were some tech issues, and every single person has to deal with some level of stress and anxiety. You know, we were dealing with it, trying to resolve tech issues for the webinar, and being able to manage those emotions, be able to manage your thoughts, and be able to come up with different solutions to these situations that can be stressful or can cause a sense of anxiety, is another core SEL competency. So moving from self-awareness and self-management, talking about social awareness, and this is how do we understand the perspective and empathize with others, even people who come from diverse backgrounds, cultures, contexts. And it has been interesting how many times at this current conference that I'm attending, which is a conference focused on education, but really the future, about how important empathy and being able to understand different ideas other than your own is so critical for the future, because of how technology is changing how we work and learn, because of artificial intelligence and its impact. And so understanding that this piece on social awareness and being able to come together and understand different perspectives. If we could go to the next slide, please, the social awareness slide. will help us. And the reality is, in this digital world, the world is only getting bigger. If we think about how technology has connected all of us. And so there is a sense of not only feeling accepted and included, but understanding those other perspectives and then being able to show a sense of compassion. When we talk about the next slide, which is relationship skills, this is really how do we establish and maintain those healthy, supportive relationships, especially when we're talking about diverse individuals and groups. And so relationship skills is critically important. And I often think about this in multiple aspects. I think about kids who are playing on sports and how important that is to have strong relationships with your teammates. I think about out of school time and kids who are in Girl Scouts or Boy Scouts and the importance of those relationship skills. I also think about how the students who are in school right now. I actually was on a site visit in New York talking to a group of students. And one student in particular, her comment struck me because she said, you know, my teachers are there to help, but who really can make the day-to-day of school easier are my peers. And so the relationships among peers is just so critical for our young people. And so how do we make sure our students not only feel a sense of communication and collaboration with their peers, but right now we're seeing a mental health crisis like none other. We're seeing kids who are anxious and stressed, kids who are trying to they're just dealing with multiple issues. And how do we ensure that they have the strong relationships with adults to be able to feel comfortable and confident in asking for help? And so these relationship skills are also critically important. Which leads me to the last competency, and I'll try to move quickly through, is responsible decision making. And every day, students, parents, all of us make decisions. And so how do we, as we think about making good decisions, how do we ensure that we're thinking about making caring and constructive choices about our personal behavior, these social interactions? And we know that also, you know, parents have repeatedly said how critical thinking skills are some of the most important skills they want children to learn. Also, as we talk about employability and you talk about the impact of technology, right now we are preparing kids for jobs that we don't even know will exist. And so how do we ensure that this next generation that will be the workforce of tomorrow can make responsible decisions? And so those are the 5 core SEL competencies. And I think it's important to understand that SEL is not, we can't bifurcate SEL and academics. What we know is that SEL has positive impact on students. And if we can go to the next slide, I just want to break down a little bit some of the benefits. And one of the things we know, there are hundreds of independent studies that have consistently demonstrated, and you'll hear from some of the other panelists in just a moment, about how social emotional learning has a positive impact on some of these core student outcomes. Academics, we know it has positive mental health benefits, skills development, school climate, and I want to unpack it just a little bit. When we talk about social emotional learning and this academic recovery, we have to understand that all the while there has been a significant impact on learning loss, we have to also talk about relationship loss and the impact that losing those relationships has had on students and academics. We know that the positive impact on academic is consistent across study after study after study. And these impacts, what we know, there was a 2017 meta-analysis, and I won't bore you with quite all the details, but when you distill it down, SEL actually improved academic performance on an average of 13 percentile points than students who didn't participate in SEL programs or have those supports. Then right now we know mental wellness is a big conversation, and one that is rightfully so dominating the education conversation, because we are hearing and seeing firsthand from our students that they are not okay and that our young people are not okay. And what we know is SEL can cultivate some of those important protective factors. I want to be clear, SEL is not in place or in lieu of mental health services and support, but SEL can cultivate what we could call or consider protective factors, which is caring relationships, having an emotionally safe, supportive environment, and that some of these social emotional learning skills can buffer against the mental health risk. Also, school climate and safety. Just yesterday, we had a moment of silence for yet another school that was impacted by a school shooting. And what we're finding is students who are participating in social emotional learning report stronger feelings of feeling included, being connected to the school, greater classroom support, better relationships with their teachers. They feel safer. Then they also have better attitudes about school and others. And so when we think about some of the pieces of conversation that are dominating the education discourse, SEL can be threaded so perfectly across all of them. The last slide I'd like to share, or I think I have maybe two more, is historically, and even now, there has been a bipartisan support for social emotional learning. It is not, and SEL has not been historically a political issue, and it's certainly not time for SEL to become one, because we know fundamentally we're trying to support our young people coming out of the pandemic and into the future. And we want to ensure that they have the skills they need to achieve that career and life goal success. And so it's just important for all of us to be collectively working together to support our students. And finally, as we talk about federal policy has provided a really important foundation to support students, not just academic, but social, emotional, and behavioral development. We are so pleased that Congress has funded the bipartisan SEL and whole K-12 initiative over the past 3 years. And we encourage Congress to write and pass appropriations bills to continue this critical investment and to ensure that federal funding for K-12 education does not decline. Now is not the time to decline our investment into our public education. This year, the Leading with SEL Coalition sent a letter encouraging appropriators to fund the Education Innovation and Research Program at $405 million, as requested in President Biden's budget. And as we continue to see the needs of our young people and students, the investments and the continued supports in academics and social emotional learning is so important. And as I close, I just wanted to share a quote from a very high profile journalist who was moderating a session yesterday with venture capitalists. And she said, quote, "Learning is a social process at its core." And it's so important for us to remember that all learning is social and emotional. And so it's just critical that we continue this dialogue. And so with that, I will turn it over. Thank you.
Thank you very much, Dr. Samuel. That was great. I'm going to introduce next Dr. Catherine Bradshaw. She is the Senior Associate Dean for Research and Faculty Development and Professor in the School of Education and Human Development at the University of Virginia. Her primary research interests focus on school-based interventions to prevent the development of aggressive behavior. She works at both the federal and state levels, having served on the White House panel on bullying prevention, worked with the Maryland State Department of Education and several other states and school districts to support the development and implementation of programs and policies to prevent bullying and school violence and to foster safe and supportive learning environments. It's all yours, Dr. Bradshaw.
Well, thank you so much. It's quite an honor to follow Dr. Samuel. I've gotten to know her well over the past year or so, and I'm thrilled to connect the dots a little bit here and think a little bit more about how we improve some of the conditions for learning and teaching. And I'm going to focus on reestablishing these because I think there's been so much challenge as the schools have reopened following the pandemic. And we are learning more and more every single day about the significant impacts of the pandemic on students' academic performance and even more so on the kind of trailing impacts on social, emotional, behavioral, and mental health outcomes. I was at a briefing just last week on recently released National Academies of Science, Engineering, and Medicine's consensus report. If you haven't had a chance to review this really exceptional report, a consensus report that was just released, I would encourage you to do so. I have a link to it in my resource guide, but this is a tremendous report that focuses on children and families, but certainly ripples out to the impacts on schools and learning as well. So really tremendous amount of information in there that is exceptionally relevant to our conversation here. And spoiler alert, I really want to connect up what we're talking about with children and youth to workforce issues for staff, because I'm from a family of teachers as well as learners, of course. But if we don't take care of our workforce issues and teachers, we are just not going to make progress in this area. I think of this period as a peri-pandemic area that we are all going through. The pandemic is having ripple effects so much for many years, and we still are living through this experience in many, many ways. There are numerous challenges that teachers are having and administrators are having on their own personal level, and those are carrying over into their workforce and their experience in the classroom. We're seeing tremendous turnover issues and instability in the workforce and the field of teaching, whether that's going into the field or sustained engagement in the field of teaching. So we've already had its challenges for a challenged workforce with issues of burnout and pre-pandemic high levels of stress. So these are important things for us to be considering jointly around how we support teachers as well as students. And as we
Now,
turn to thinking, yes?
I'm so sorry to interrupt you. You can see the next slide. Do you want to
Oh.
switch display?
I'm sorry, is
Oh,
this
it's fine.
does that work?
No
Sorry, I
problem.
didn't realize I was on
No.
a different view.
No, it's great. Thank you.
Excellent. Hopefully that helps. So again, turning more directly to some of the impacts for students, we know prior to the pandemic, about 20% of school-age youth were experiencing serious mental health issues, and relatively few of those students received services, but the bulk of the services they were receiving were within the school building. The situation is significantly exacerbated by the pandemic. There's been a 40% increase in youth mental health concerns since the onset of the pandemic. About 20% of youth are reporting depression symptoms, 25% anxiety, and we're seeing about a 50% increase in suicide. My two colleagues, Dorothy and Mark, are going to talk much more about both of these topics in their subsequent slides. So I will prepare you for additional data on both of these topics as we move forward. But school staff aren't used to really assessing these and detecting, especially our internalizing symptoms. They're pretty good at detecting some of the externalizing problems. My colleagues and I wrote a few papers several years ago called the squeaky wheel. So they're good at detecting kids that have externalizing problems like disruption and problems that drive teachers a little bit batty on occasion, but they are not as adept at detecting internalizing problems. And that's why early identification systems like screeners are so important. And in fact, we have an IES-funded center right now, the Center for Rural School Mental Health, that was actually funded through one of the research and development mechanisms right before the pandemic, and very appropriately so, focused on rural schools to help us scale up evidence-based practices to meet the needs of rural schools that often don't have access to evidence-based practices. My colleague, Wendy Rinke, who's been doing quite a bit of work in Missouri and other places throughout the country, had developed this evidence-based tool to help teachers identify students that had unmet needs, but not only some of the challenging internalizing problems, but other kinds of challenges, as well as some of the strengths too, and help teachers identify students that might be in need of additional supports, but also providing an opportunity for students to self-identify different kinds of concerns. And not just putting this data in the hands of teachers, but also providing them a platform or an intervention hub online to be able to access evidence-based practices to meet those students' needs. So these are some of the tools that are really so essential that we give free access to schools to be able to use, especially as part of this pandemic recovery period. And the data is only as helpful as we provide training and support. And as we think about reestablishing these conditions for teaching as well as learning, we need to be thinking about frameworks for that kind of support. And data such as screening and how to make decisions based on that all need to be coupled with evidence-based practices like those evidence-based social emotional learning programs like we heard about from Dr. Samuel, as well as systems for teaming processes for teams to make good decisions about how to adopt evidence-based practices, how to de-implement programs that aren't very effective in schools. And the purpose there isn't just throwing a whole bunch of programs in schools, it's making good choices about how to implement effective programs and making good decisions about implementation with high fidelity and how to work with teams and how to work with coaches to ensure high fidelity. And one of those frameworks is called Positive Behavioral Interventions and Supports. This is one of the most widely implemented frameworks for implementing evidence-based practices currently in place within the United States. Over 29,000 schools are implementing this framework with support from the Office of Special Education Services, Supports and Services, and the National Technical Assistance Center that's based at the University of Oregon. Really important work that's happening through this National Technical Assistance Center, and I'd encourage you to learn more about it. We've done quite a bit of research around this particular model, and it follows a public health approach to prevention. In fact, there's really very important work coming out bridging the public health approach to what's happening around prevention in schools, whether you call it PBIS, whether you call it multi-tiered systems of support, follows this general framework of tiered implementation, where you have universal supports that are available for all students that need any kind of access to these supports in the building, selected or targeted kind of interventions that might benefit from those kind of screening types of approaches, as I was mentioning, and then indicated or intensive interventions for students that need more tailored types of supports, particularly ones that may include families or more function-based interventions. These all can be knit together within the school and implemented through training and professional development models. Our team has done quite a bit of research on these models, as have others throughout the United States. And in fact, there's very systematic research through randomized controlled trials showing significant outcomes for students, that some of which are listed here. These models can reduce a range of outcomes, including bullying, suspensions, aggressive behavior, inappropriate referrals to special education. And it's important that I comment on this. We don't want to deny anybody access to those kind of services. But unfortunately, some students are sent to special education because schools don't know what to do. And we don't want to unnecessarily use those specialized services. We want to protect them and make sure they're available for students that are truly in need of those services. So that way we can utilize them for students that are truly in need of them. We also want to make sure that we can meet the students with higher risk needs. And in fact, we find that these kinds of models often benefit the students with higher risk more. So by implementing these school-wide strategies, can somewhat improve the overall conditions for learning, so that way students that need more intensive services actually get them. So it's like by improving the overall climate of the school, those students with increased need actually get those more specialized services at a higher rate. And not only does it cut down on the problem behaviors, but it improves the positive things, like many of those social emotional competencies that we've heard about, like emotion regulation and pro-social behavior and good decision making. So a lot of those social emotional learning competencies that underlie some of these behavioral outcomes that I've got listed here, as well as good skills for teachers as well around classroom management and academic outcomes for students. And in fact, by implementing these strategies, we also see positive outcomes for teachers. We're seeing teachers are reporting that the school climate is improved, that the principals are able to effectively operate their building. Just by implementing these programs, we're seeing that the staff are getting along better with each other and that they're able to focus on academics over discipline. We've been conducting with my team over 4 randomized controlled trials of these different models and have collaborated with teams and other similar studies as well. And we've got a longer list of lessons learned. In fact, we found some of these impacts tend to be stronger at the elementary school level as compared to the secondary, but we still find effects at secondary level. That sometimes shows up in other models of prevention where the earliest you intervene, sometimes the more robust the findings are. We get a lot of benefit from this tier 1 support, especially among those higher risk students. We get synergistic effects when we combine these multi-tiered interventions with SEL programming. But you need to have good coaching supports in place and need to think about fidelity from the beginning to optimize implementation. You also need to work in close partnership with district and state. You can't expect schools to do these kinds of strategies on their own. And what's important here is we've done cost analysis. So these aren't just goodwill kinds of efforts, and they aren't particularly expensive. In fact, we have done a series of 6 different cost analyses of these models and found total net present day cost savings values of $450,000 for 100 elementary students. Yes, those are US dollars, and these have done in consultation with cost analysts. At the elementary school, presented here, and 86,000 for near every 100 secondary students. And that takes into consideration a large range of academic, bullying, aggressive behavior, and suspension outcomes. Happy to provide the references for you. So this actually is a model showing that prevention not only improves outcomes, but can actually save money as well. We've also done work around the discipline gap and provide evidence by implementing these strategies, we can improve and tighten the discipline gap here, particularly with regard to Black and Brown students through professional development and coaching, focused on these core elements of effective classroom management and culturally responsive practices. We've done a number of studies funded by IES and National Institute of Health, focused on coaching teachers around leveraging effective strategies to help tighten those gaps. And I wanted to talk a bit about the reauthorization related to IES, because without effective research practice partnerships, none of this work would be possible. I've been the beneficiary of quite a few great research practice partnerships, especially in the state of Maryland, and wanted to highlight a few core elements of that as we think about policy implications for IES going forward. Researchers really need opportunities to leverage these longitudinal data systems. I highlighted that example of the policy analysis to be able to look at cost benefit analysis. We have another ongoing study now where we'll be looking at longitudinal impacts on juvenile justice reductions, as well as high school completion. And without the opportunity to collaborate with state partners to look at longitudinal data system outcomes across data sources, not just Department of Education, we wouldn't be able to have that. And only through these kind of research practice partnerships are we able to look at those kinds of impacts and policy analyses. It's important to not just focus only on academic outcomes. In fact, we're all here today to be talking about these broader set of outcomes for students, including social, emotional, behavioral outcomes, and thinking more generally about the context for teaching and learning, including workforce issues. If IES and Department of Ed continue to stay so narrowly focused on academic outcomes, we're going to be missing so many important outcomes for our students and undermine the whole broad whole child initiative that is so important and critical, especially coming out of the COVID recovery situation. We also need to be continuing these partnerships to be conducting meaningful research on topics that are so timely and address local needs. In fact, the work on SEL and social emotional learning more generally, as well as positive behavior support, these are issues that schools are really grappling with. How to do this work well, how to sustain these efforts. And we need research practice partnerships to ensure that we're building that infrastructure to scale up and sustain those practices well. The National Center for Rural School Mental Health is one example of those kind of outgrowths funded by IES. And here's a web link. We have an online free resource through the center where schools can access some of those screeners I mentioned, as well as a free intervention hub as well as an implementation hub. So that way they can implement different evidence-based practices with high quality and success. So without these kind of research practice partnerships, schools wouldn't be able to access these. These are a couple of resources, and I look forward to having some time during the Q&A to share out some other ideas and hear from the audience as well as my colleagues who are up next. Thank you.
Thank you so much, Dr. Bradshaw. That was great. I'm now going to introduce Dr. Dorothy Espelage. She is a distinguished professor of education at the University of North Carolina in Chapel Hill. Over the last 25 years, she has authored hundreds of papers and books on bullying, homophobic teasing, sexual harassment, dating violence, and gang violence. She advises members of Congress and the Senate on bully prevention legislation. Her research is guiding state, national, and international efforts to prevent youth violence and promote positive school climates. She authored a 2011 White House brief on bullying among LGBTQ youth and has been a consultant to the National Anti-Bullying Campaign, Health Resources Services Administration, and the U.S. Department of Health and Human Services. Dr. Espelage, please.
Great, thank you. I want to see that. Sorry, I'm trying to pull this up.
You're fine.
Yeah, just disappeared. Let's try it again. There it is. All righty. All right. Thank you very much, Dr. Samuel and Dr. Bradshaw, for setting me up wonderfully to talk to you about leveraging technology and engaging youth. So we've heard about the importance of social emotional learning, and we've heard about the systems approach and really bringing on all the stakeholders and collecting data. What I'd like to do in the next 12 minutes is to talk to you about some experiences we've had. As Dr. Bradshaw noted in her research with the PBIS model or the multi-tiered model, we really do get those large efficacies. It really works well in elementary school. And then what we find is that as we think about social emotional learning, whether it's bullying prevention or school climate approaches, we see that the efficacy or the effectiveness drops off in later elementary school, even lower in middle school. And we've all been challenged to think about how to create prevention programs, universal programs to impact behavioral health and education success, bullying prevention and school climate approaches in the older years in high school. And so we are heavily funded, my lab there at UNC Chapel Hill, by the federal government. So anything that I share here is the opinions of my scholars and my team, not that of the federal government. As we've already set up, we heard from Dr. Samuel of the importance of thinking about social emotional competencies in K through 16, I would argue. We've heard the importance of having policies and practices and screening and behavioral expectations for youth. We have also heard that we really need to pay attention to ongoing all staff training with a particular focus on educators' mental health. And certainly our latest survey with the American Psychological Association task force chaired by Dr. Susan McMahon at DePaul found that we have upwards of 50 to 60% of teachers that are contemplating leaving the profession. And certainly, and a lot of that really as a result of mental health challenges, not feeling supported. And they really are asking for additional training to address the mental health in their classroom, but also the challenges of behavior. So when we think about effective bullying prevention as one example of mental health in K through 12 settings, all of these have to intersect together. So we have to really integrate these policies and practices and training and really hone in on those social emotional competencies, both of the youth, but also of the adults that are surrounded by our youth. We also can take a huge body of literature, which we've contributed to, but others on this panel as well, and colleagues all over the world, is to really understand that the interconnected risk of all of these, whether it's bullying or mental health outcomes, suicide indicators, which we know is really critically important right now, but we also need to focus on those protective factors. So that would be that social emotional learning, building trusting relationships that are consistent, really making sure that our kids, when they step in that school every day, that they have a trusted adult that they can turn to, but also building those relationships with their peers as well. So I want to hold on just a little bit here to what we've learned before the pandemic, heavily funded by the National Institutes of Justice Comprehensive School Safety Initiative, where many teams across the country were trying to figure out how it is that we can address school climate, prevent school shootings. And so we dug deep with a particular grant, who the PI was Claudia Vincent, Dr. Claudia Vincent there at the University of Oregon, who continues to do this work. So I'm just going to talk about what we did, and she's expanding this with additional funding. We actually sat down and wanted to talk to youth, especially in middle schools and high schools, to figure out what they thought about their perceptions of their school climate. Whoever we talked to, whether middle schools or high school students, they really wanted adults in the building to work harder to establish a positive school climate. They felt in some instances the adults were doing a really good job attending to their physical safety, all the hardening that might be happening, metal detectors, clear bags, reporting systems, but felt that they fall short in understanding their emotional safety. They also called out, as Dr. Samuel did, that there were issues around fairness and equity. And they wanted to talk about that. They wanted to have a voice about their own perceptions of inequities, whether that's in tracking of classrooms, whether that's referrals to special ed, as Dr. Bradshaw referred to. But they also wanted to be part of that solution. Even though they were upset and disappointed in adults and didn't necessarily have the trust, when they did feel that they had that trust, they were more likely to talk to the adults about what they were seeing among their peers, any kind of concerns around safety. But we also know, as I said before, that these school-based interventions, whether it's the suicide outcomes, the school climate outcomes, violence outcomes, really are most effective in K-5 settings. We've conducted multiple meta-analysis to show this. And the effectiveness decreases in middle school and high school, which has led us to think about perhaps it's because we have not been incorporating the youth voice. The youth in the building know more than the adults most of the time, and it really does take that trust. And so maybe we should incorporate their voice into the development of these programs, whether it's social emotional learning programs or school climate approaches. And that's what I'm going to highlight now. This is just one example. And again, this was the NIJ grant that was headed by Dr. Claudia Vincent at the University of Oregon, where for 5 years we worked with youth, parents, and teachers to develop what's called the Advocator. Even the name Advocator was coined by the youth in both Oregon and the state of Illinois. And the youth really insisted that it's not just a matter of reporting safety concerns that they have, but they really wanted to be able to report their own mental health challenges or those of their peers. But they wanted resources, not simply just reporting apps, which we have many of those out there. Around this, we also built curriculum for the students with the input from teachers and parents, resources for parents and teachers, but really at the center of this were the high school students' opinions, and many of them stayed on through the entire 5-year project. Something that we're very proud of. So if you see the Advocator, reach out to us if you want more information, as Claudia is really trying to do some additional analysis and evaluation of this program. We also heard from students that a lot of the bullying prevention approaches were kind of just, they're sitting there, the content was delivered to them, but they felt as if they really could not immerse themselves in those experiences. So we developed, with the partnership of Google VR, what was called the Stand Up, a virtual reality to activate bystanders against bullying. And we know that upwards of 60% of kids in bullying situations are not actively involved, but watching. So we sat down with the Google VR screenwriters and youth aggression experts to write 3 really short 5 to 6 minute vignettes where we know from developmental science that as you experience things, and many of these students were engaged in gaming themselves, that we might be able to improve the empathy and perspective taking rather than just doing some role plays within the context of a classroom. And what we did find in a small scale RCT study that we had significant increases in empathy and willingness to intervene over these 6 sessions, which is amazing when we think about bullying prevention and the fact that we're only reducing bullying under ideal situations, 17 to 20%. And so this pilot justifies further exploration of incorporating VR to reduce youth violence. And I would encourage you to consider this as in conjunction with classroom social emotional learning curriculum as well. We also have heard from teachers that here we have this great social emotional learning program and they're so engaged in the activities in the classroom. And then we go out for recess and it's as if we didn't talk about anything. And so that made us think, Michelle Ybarra, who's the PI on this NICHD grant that we have, that how can we pull through some of the lessons of the social emotional learning that we have in the classroom, but really have youth think about practicing these skills in real time, where they may not be sitting next to a child that is bullying them, for example. It's hard to engage in role play if someone is being mean and cruel to you. And so with middle school students in the state of Illinois, as well as the state of North Carolina, we developed what's called Bully Down. That was their name. And they wrote with us text messaging programs. We'll be evaluating this in a small RCT this summer. And we were hoping that this is something that we can incorporate, not just with the classroom curriculum or the framework, but also do this in after school programs. This might also help us to reduce the amount of classroom instructional time that we need to do this work. So I also just want to, and there's been some suggestion of the Centers for Disease Control data. This is a YRBS data for 2021. And I want to show this because I think we say that we have these numbers, but I think there's something very powerful to think about the mental health state of our youth. And these are 7th through 12th graders in a nationally representative sample. And this is 2021. So you get the height of the pandemic, where we have 30% of females and 14% of males that have considered attempting suicide in the last year. And I'm going to roll through these given time, but I think we need to make this very concrete as we think about this over time. When we think about sexual orientation, LGBTQ+, which is a population that is suffering in some of our states, a very high percentage thought about attempting suicide in the past 12 months. When we think about actual suicide attempts, 13% of females, 7% of males, with an equal distribution across race, a little bit higher for American Indian. When we think about actual attempts, we have high numbers here that's actually staggering. So we think about some of the legislation that's in place to take away some of the program that we have in K through 12 that is known to be protective for LGBT and gender sexual minority youth. There's cause for concern here. When we think about bullying at school, there was a suggestion in some of the data that cyberbullying went up during the pandemic, and we'll have to see what happens in the coming year. But during 2021, there's still 17% of females and 13% of males that were bullied, a high percentage for LGBTQ as well. And when we look at sexual assaults and sexual violence, 18% of females have experienced sexual violence and sexual assault in the past 12 months, and a high percentages of LGBTQ+. And then we also have to think about, now you can interpret these numbers in 2 ways. I'm going to frame it as 42% of females do not feel connected to a person in a school, with 35% of males not feeling connected. This is staggering because in the 25 years that I've done this, usually we had only 20% of kids that said they did not have a single adult in the building they could trust. So clearly we need to really hone in on school connectedness and building stronger relationships, not just among peers, but also among peers and teachers. And certainly this is the same for LGBTQ youth, and we're going to have to watch these across the states as we're continually not allowing some of this work to be focused on gender and sexual minority youth. But I have a solution. that may be helpful. So we had currently, prior to the pandemic, we're evaluating a program called Sources of Strength, which is a peer-led program that focuses on developing protective factors that uses a model that is strength-based. But we do that by training peer leaders to connect with trusted adults and to create campaigns to promote school climate and connectedness, but unique to the context from which they are embedded. There's a use of active learning model incorporating arts, storytelling, small group sharing that really explores the 8 protective factors depicted in this wheel: the importance of mental health, family support, positive friends, mentors, that trusted adult, healthy activities, generosity, spirituality, medical access. And all 8 of these are embedded in an evidence base of developmental science that shows that as we have more of these protections in our life, there's less likely the result of suicide, there's more likely to be school connectedness over time. The evidence is strong for sources of strength. Several high school RCTs have shown increasing connectedness to adults, increase in school engagement, increase in likelihood to appear to refer a suicidal friend to an adult, increasing of the acceptability of seeking help, which often sometimes is stigmatized. Largest increases among those students with a history of suicidal ideation, and a trial that we just finished prior to the pandemic. We had decreases in sexual harassment, violence, and dismissiveness of sexual harassment when kids were exposed to more of the parts of the wheel. And even more importantly, in that trial, we were able to decrease subsequent suicide attempts among all youth in the trial. And so those are just some ideas. I want to set this up for Mark, my colleague Mark, to really focus on the youth and how do we build that connectedness to promote both mental health, but also academic success in the classroom. And just called your attention to the World Anti-Bullying Forum that I'll be hosting with the University of North Carolina, October 25th through the 27th. Hope to see you in Raleigh at that time. And then you'll get this PowerPoint with a number of these resources, but I appreciate your time. And I will hand it back to Demi.
Thank you, Dr. Espelage. That was great. Okay, next up, we have Dr. Mark Van Ryzen, who's a research associate professor at the University of Oregon. His core research interest is the development and integration of streamlined, efficient prevention strategies into large-scale K-12 educational systems. His current work is evaluating the impact of small group instruction on positive peer relations and subsequent cascading effects on student behavior, social emotional skill development, and mental health. His long-term goal is to develop an easy-to-use technology platform to support teachers in delivering small group instruction in a widely accessible, scalable, and sustainable manner. Mark?
Thank you. Are you seeing my presenter view again?
We see the next slide.
Yeah, okay. How about now?
Perfect.
Great. Well, I apologize, everyone, that we are a little bit, we're going a little bit over schedule, so I'll try to go as quickly as I can through this. I definitely appreciate the opportunity to be here and to discuss an issue that is very close to my heart, and that is social issues in education. Now, we're all here, of course, because the pandemic has created a lot of negative impacts on student mental health. I think that's been widely disseminated and widely accepted. However, what isn't discussed as much is the fact that student depression was already on the rise before the pandemic. And similarly with education, again, I think we're all aware of some of the academic impacts of the pandemic, learning loss, increases in dropouts, and these things are particularly serious, as are the mental health issues for low-income, underrepresented youth and families. These folks are particularly vulnerable. But once again, these are issues that we were even seeing before the pandemic in a variety of areas. NAEP reading and math scores, for example, very flat over time and never really attaining what they defined to be proficiency. So from my point of view, the pandemic did not necessarily create these problems for us, but it did make them worse. And I think in doing so, it highlighted some of the issues that we need to grapple with in our educational system. And Dr. Espelage and others have highlighted this quite well. The idea of paying attention to some of the key social issues, some of the social impacts that the educational environment can have on students. Now, I think everyone here on the panel and probably a lot of folks watching would agree that learning is a very social process. Students learn better, as we've all heard today, and as we've all seen in our own lives, I'm sure, they learn better in a positive social climate. And so from my point of view, the key question is, are social issues at the root of this problem that we are seeing, not only from the pandemic, but even before the pandemic? So if learning is profoundly social, how does it work? What are the key things that we need to pay attention to? Well, negative peer interactions create a profound amount of risk for students. They're very stressful, particularly middle and high school students. That's where we see a lot of the impacts. The achievement of peer acceptance, positive peer relations is a key developmental milestone for students in adolescence. The stress that negative peer relations can create will interfere with learning. It'll create mental health problems. On the other side of the coin, positive peer interactions, when we can create them, can reduce a lot of this stress. Students learn better. There is more engagement and achievement in an environment of social acceptance. There's fewer mental health problems. The decades of research will attest to that. So what the pandemic has done, I think, is it's revealed some of the limitations in how schooling goes about dealing with some of these social issues. What we saw during the pandemic is that students who possessed a certain degree of social capital already, due to existing friendship networks, due to having well-developed social skills, adaptive home environments, et cetera, they were able to access social connectedness. They were able to access the social support they needed in spite of school closings. And for these students, we see lower levels of some of these academic mental health problems. However, there's another group of students that did not have the social capital they needed to be able to cope with the school closings. These are the students who are on the periphery of the social network. These are students, and Dr. Espelage highlighted this in particular, these are the students LGBTQ, students with disabilities, students of color, students without well-developed social skills. These are the students on the periphery of the social network that were most at risk before the pandemic, and that was really emphasized by the school closings. They were not able to access social connectedness, social support, and this is the group that had experienced and continues to experience the most severe problems with engagement and mental health, suicide, school violence. The unfortunate stories that we see in the news about school violence, these are not stories of students who are popular, who have lots of friends, who are widely accepted. These are stories of students who have been discriminated against. These are stories of students that have been victimized, that have not been able to achieve a degree of social acceptance in their school environment. These are the students where we really need to reach. We need to reach these students in order to be successful in dealing with some of these problems. So how do we generate peer connection, social capital for these students that need it the most? Well, in my career as a researcher, the only thing I've ever seen that consistently creates significant and positive change in peer relations, particularly in the middle and high school level, is a particular kind of small group instruction called cooperative or peer learning. And this is not a typical informal or less structured approach to small group learning. This has very specific design dimensions that are required in order for it to be successful. We have to implement contingencies so that students benefit personally from helping others. We have to ensure that each student has a unique role so that they can be held accountable. And other things. There's lots of different dimensions that have to be put in place for this kind of small group instruction to work. And what we most commonly see, unfortunately, is less structured, less formal approaches to small group learning without contingencies to encourage supporting others, without accountability so that students will not contribute to the success of the group. And what we see as an end result of these more informal approaches is negative social and academic outcomes. And I think research supports that the vast majority of small group learning that occurs in schools is this less structured version. this less formal version that again can create lots of negative outcomes. I see this all the time when I'm visiting schools, and I have children in schools that experience these less structured small groups that are not able to create some of these positive outcomes. When we implement small group instruction with fidelity, we can get all kinds of positive academic and behavioral outcomes. This is information from a meta-analysis, a study of a whole field of research by a researcher named John Hattie in Australia. He categorized more than 250 different things that influence student achievement, and then he ranked them by their effectiveness, by the power of their effects. And number 7 on this list of more than 250 influences is the jigsaw method, which is a well-known but complex version of cooperative learning, a very structured version of small group learning. This is number 7, extremely powerful influence on student academics. And interestingly enough, more powerful than a student's prior ability and more powerful than a student's self-efficacy. So the takeaway here is that when we implement small group learning with fidelity to some of these design principles, we can overcome whatever limitations a student may bring into our classroom. This is a very powerful approach with regards to academics. Now, what else can it do? Well, when we implement it with fidelity, again, we can create situations in which students from different social groups are working together and experiencing success together. Again, incentivized to help one another, incentivized to perform their role for their group. We can build positive peer relations. We can bridge gaps. We can reach across the boundaries of social networks and help students to build positive peer relations. And from that, we have all kinds of positive downstream effects, cascading effects on developing social emotional skills experientially through working in small groups. Reducing social stress, improving behavior, reducing mental health problems. So there is a variety of positive outcomes that we can achieve by considering pedagogy as much as curriculum. And so that's another key takeaway I want to leave you with. When we talk about education, we always talk about curriculum, but we rarely talk about pedagogy. And the pedagogy, the way in which we teach, is just as important as what we teach when it comes to learning, when it comes to mental health, when it comes to behavior, all the things that we want to see out of our students. An additional aspect to this is that because we are reaching across these social group boundaries, because we are giving students who are on the periphery of the social network the ability to connect with other students, we often see stronger effects for some of these students who don't currently have a strong social network, students of color, students with disabilities. What we find in schools where we're doing this evidence-based form of small group instruction is that they're able to build positive peer relations. They feel less social stress, and as a result, they can achieve to the best of their abilities, no disparities. In control schools, where students rarely have opportunities to build these kind of relationships, we see that this social stress accrues over time and has a strengthening effect as time goes on. And students who are, again, on the periphery of that social network, the most at risk are the ones for whom we have the worst outcomes, widening disparities over time. Now, cooperative learning isn't just something that I advocate. There is a lot of research that attests to a lot of these positive effects. Office of Education Research advocates for cooperative learning. AACU advocates for cooperative learning. NEA puts a spotlight on research as a best practice in education. So why don't we see it more often? Well, my experiences and the research of others leads me to conclude that there's a number of reasons. One is that these core principles are not widely understood. Even when they are understood, they're complex, they can be difficult to implement. And educators don't have the time and the ability to really investigate some of this, try this over and over, build the skills that they need in order to become experts in this pedagogy. So in response to this, myself and a few others have put together a software platform that helps teachers to implement evidence-based small group instruction, cooperative learning, peer learning, with fidelity to these design principles. It allows teachers to input their existing curriculum and their learning materials for any subject, and to teach these lessons in a way that is scalable, accessible, sustainable, and is able to reduce the implementation burden on teachers. Just as a quick example, and I know this is difficult to see, but the technology platform provides teachers with the ability to manage groups very easily, to manage the lesson phases, to design their lessons very easily. And for students, it provides all the information they need in order to concentrate on learning. They have their materials, they have their task list, they know who they're working with, they know how much time they have left in this phase and what's coming next. So the implementation burden on teachers is vastly reduced when we're using technology to implement these evidence-based best practices. So we recently did a one-year randomized trial of this technology, teachers using it versus schools who are doing business as usual, and found a variety of positive outcomes at post-test. Higher levels of all 5 CASEL competencies, higher levels of peer relations, peer support, significant reductions in drug use, reductions in stress, reductions in mental health problems. Interestingly enough, improvements in sleep quality. There's a lot of, again, a number of positive outcomes that can arise when you simply reduce the social stress that students are feeling every day. Improvements in teacher efficacy and reductions in stress and burnout. This one is particularly interesting. When students are in small groups and they are working together, a teacher is much less burdened as compared to a situation where a teacher is doing whole class instruction. In whole class instruction, a teacher is responsible for engaging each student in the room individually. When we are doing evidence-based small group instruction, the teacher is effectively recruiting all the other students in the classroom to support those students that need it the most. And so rather than being the so-called sage on the stage, very stressful, very difficult position for teachers to be in, they can become the guide on the side. They can move around the room, they can answer questions, they can listen to the conversations. And as a result, in our trial, we found that teachers felt more effective and they felt less stressed. And finally, we found dosage effects. The more teachers did this, the more we found these positive effects accruing. And the nice thing about this sort of small group pedagogy is you can use it in any subject. You can use it all day long, and you can use it all school year long. That isn't to say, though, that we require teachers to do this all the time. And in fact, in our randomized trial, we found these significant positive effects from teachers using it about twice a month. So it isn't anything that has to happen all the time. But again, the more you do it, the more powerful effects will accrue. So key takeaways here. I think the research that you've heard from my fellow panelists and as well as my own can give you a sense that there is not enough attention being paid to the social aspects of learning and mental health within schools. And yet it is vitally important. It is a key aspect of creating an environment in which students can learn, in which students can be successful. The second takeaway is that when we think about social emotional learning as something that can address that problem, something that can help schools to start to consider social aspects, this doesn't necessarily have to imply a SEL program or a packaged SEL curriculum. We could implement an SEL approach that involves structured small group learning. This can work just as well or better. It doesn't have to be an SEL program. There are lots of ways we can achieve these goals. And then if we do consider the barriers to implementing complex structured small group learning, we can leverage technology to address some of these barriers. And finally, when we do this well, we see that the effects are strongest for the students that need it most. And that's really what we need when we start talking about school-based prevention. So I really appreciate your time and attention. My email address is here. Please feel free to get in touch with any questions that you might have. More than happy to discuss small group learning with or without technology with anyone who's in attendance here.
Thank you so much, Dr. Van Ryzen. That was spectacular. Our last, but certainly not least speaker, our discussant is Lakeisha Steele. She brings a wealth of experience in education policy at the federal level. She most recently served as the Deputy Assistant Secretary in the Office of Legislation and Congressional Affairs at the U.S. Department of Education. And prior to joining that Department of Education, she served 8 years in the legislative branch between the U.S. Senate and the House of Representatives, including leading K through 12 education on the House Committee on Education Labor. She is guided by a key tenet that all children are entitled to equal educational opportunity. Lakeisha.
Thank you, Dr. Fishman. I really appreciate the lovely introduction. And due to time, I am going to make my remarks very, very, very quick for each of you. We've heard powerful remarks today from Congresswoman Bonamici, Dr. Samuel, Dr. Bradshaw, Dr. Espelage, and Dr. Reason. And we've heard about the strong evidence base for social and emotional learning. We've also learned here today about the impact of the COVID-19 pandemic on student learning and well-being and the youth mental health crisis. Disparities in education and in our youth mental health issues were on the rise prior to the pandemic. As Dr. Reisen stated, the pandemic did not create these problems, it made them worse, and issues that we have today are very important to have an education system that's designed to grapple with them. We've heard about social emotional learning, the importance of our 5 competencies, looking at a systems approach. We heard Dr. Bradshaw take us through PBIS and MTSS models, the importance of collecting data, the importance of social emotional learning, and Dr. Espelage walking us through bullying prevention and school climate approaches, SEL as a protective factor, and the importance of ensuring that our educators and school leaders have the training and investment to support their well-being. According to cost benefit analysis, we know that for every dollar spent on SEL, there is an average of $11 return on investment. Education accounts for less than 2% of the federal budget. 2/3 of the American public support increased investments in education. Increased funding can help accelerate academic learning and support students' social, emotional, and behavioral development. Student needs today are greater post-pandemic, and now is the time to ensure that students have the resources to be successful after a decade of underfunding. There is continued discussion around the national debt ceiling and potential cuts to funding, and particularly education. Yesterday, we heard our Secretary of Education testify before the House Labor HHS Subcommittee on the President's fiscal year 24 budget. The Secretary explained that we have a choice to give students more, not less, with federal investments. We encourage Congress to support greater investments in education to support the academic, social, and emotional and behavioral development of our nation's children. We are also pleased to see the Senate Help Committee invite education stakeholders to inform the next reauthorization of the Education Sciences and Reform Act. As you have experienced here today, we have salient education researchers who are at the forefront of understanding the important role that education research plays in designing an education system that supports all young people in realizing their fullest potential. Their research today that they discuss, it not only is supporting our students, but our educators, our school leaders, our parents, and community-based organizations to ensure that students have the supports that they need to be successful in school and life. We look forward to seeing action from Congress and appropriations, and as well as the reauthorization of our next education law. And with that, I will turn it back over to Dr. Fishman.
Thank you so much, Lakeisha. We do have a few minutes left. I've asked if anybody has any additional questions, but there is, I believe, one question that hasn't been addressed. So if the panelists want to show their faces, we can see who might be able to address this. It's rather long, but I don't want to lose any of the context that's presented here. So Vanessa would like to hear your experience of any known scholarly work around addressing behavioral policy change due to implicit bias within majority-minority communities. She lives in a minority, such a community where there's strong pride and sense of self-preservation, and then lists a few organizations and HBCU affiliated closed societies, etc. Graduation rates are 86% for African Americans. However, what is not discussed is the near 40% of the school system is Latino. And so despite the statistic, professional employment of Latinos is only 5%. So you can see the full question in the Q&A, but does anybody want to take hold of that and, wants help in affecting behavioral policy change at the political will level in this regard.
Denny, I'll take a piece of that. I think that the developmental science is just emerging now on really understanding how it is that we can address implicit bias related to the Latina population. That ties into what we're very concerned about, and that is linguistic discrimination. And so as we have ELL students, we really need to think about training teachers and administrators to understand implicit bias, how it relates to linguistic discrimination. As we are, moving children where English is not their first language to English. Unfortunately, because of the linguistic discrimination by some of our educators and administrators, it silences those students in ELL. They do not speak up. So that's just from a developmental science perspective, that certainly there are scholars that are young scholars and early scholars that are trying to address that in our schools.
Catherine?
I would just comment that we've done a number of projects around culturally responsive practices and also have a couple of grants that look at evaluating the implementation of various policies around disproportionality. And unfortunately, we find a lot of unevenness in implementation. Relatively few of those policies really make it down to implementation at the building level. There's a lot of kind of forms filled out at the school or district level saying, oh, we're doing all these things to address the policy, but we don't really see a lot of evidence of that when you get it to the building level. And even when there are observations that must be conducted at the classroom teacher level, teachers get that data back and they're like, I don't really know what this means. Even anecdotally, my own sister is a teacher and she was asking me, she's like, I just was teaching a math class the other day. I was getting an evaluation from my principal. And I was asked like what kind of DEI activities I was doing in the math class. And she's been teaching for over 20 years and just was confused around that. And, having done work in this space and, really we need to be providing a lot more coaching and supports. And this is what we do with our double check work, is to try to change the narrative around and not punish teachers with data, but really try to coach and support. And our models use motivational interviewing and provide exemplars and opportunities for growth in this space. And I think a lot of the policies have come down as very harsh and punitive rather than opportunities for growth and professional development in this area. And so that's what we've found is in the kind of policy evaluation. What trickles down to a classroom or a school is very different than what is kind of aspirationally written in the district or state level policy.
Right. Yes, that's an excellent answer. Dennis Embry from Paxos Institute, did you want to offer something as well?
Sure. I don't know if I don't think I can. Oh, there I go with my video. Yeah. Thank you very much. I'm really, most of you I know, and you are heroes in my life. I'm a weird creature because my emphasis has been on taking these findings and putting them into population level implementation, which is a whole different thing than what we do normally in these RCTs or comparative effectiveness trials. I'd like to tell you that it is possible to create such things. For instance, we did a randomized control group trial in the entirety of the province of Manitoba, which has a lot of indigenous peoples. It has a lot of recent immigrants, and obviously just normal human beings out there. And we were able to show that the good behavior game within one semester could mitigate many of the emotional and behavioral disorders that we were finding in the building. And we saw that those results continued to the 5th grade. Now, when you do the whole GBG thing really, really well, you get really long-term results. But the fact that we were able to teach teachers how to do the PACS Good Behavior game, we had no technical support. We only had a 3-day training, and we were able to move the needle in the province. Now, presently, There are various states who've actually also started to do PAX GBG in the states. That's Ohio, Arizona, and when Texas called, I nearly needed a respirator because it was like, hey, it's big and Texas. So there's some great opportunities here for early career people to dig into this, to see, what can we do to maximize both the implementation and the maintenance of all of this, because so few of us have had the opportunity to do population level things. And I was a weird kid on the block. And in grad school, I did that. I did a population level strategy, thankfully, through the agency of Sesame Street. And so, that was a place to begin. And it's possible, but we're not thinking about how we package and how we train and how we support and how we advertise and how we mobilize people. And so what we've also done is to take the same active ingredients that is in the PAX good behavior game. There's 10 evidence-based kernels, small units of behavioral influence. And we've also created PAX tools so that those can be used by parents, after school people, boys and girls clubs, all those kinds of things to create a culture which is lifting up not just the children, but all the caregivers around them. And the most powerful thing ever said to me was when we launched in Manitoba, the grandmother circles, there are 12 grandmothers in the circle who go around and study all these things to make sure that the white people who are coming down the road are reasonably okay. And so she stood up and she said at the opening of our Manitoba thing, she says, well, she's like 90 years old. And she says, well, Dr. Embry seemed he was very smart and he talked in all of these words and so on. But after I listened, I came to understand this was the way our people used to raise our children before the white people came. That required resuscitation on my part because there's a bit of truth to that.
Right.
The simplicity is really important for getting scale, that everybody can understand how it works. It doesn't require, and yes, Catherine is involved in our work, and she knows that we actually changed BDNF gene expression with a good behavior game, but people don't need to know that. What they do need to know is that it works now with my kids in my classroom, in my home, my school, my town. And if we can do that, we can change the world.
Yes. We're with you, Dennis.
Okay.
So just.
I know I'm weird.
We all know that, but you're also brilliant.
Yeah.
So just, if people are still on, and there's just a couple more very quick questions. If you have time, if you don't, please, go ahead and jump off. But Paula Smith has a question for all. She was in a presentation earlier about countering misinformation. How can we as researchers do a better job in countering the misinformation regarding the topics that we've covered? So who wants
I have a suggestion? Go to the Kiwanis Club, Rotary clubs, and all of those kind of clubs and give a talk.
Okay, that's dissemination.
Yeah,
right?
that's the people who run the community.
Mhm. Yeah.
Well, I would add that I think that, there's some states in this country that are requiring media literacy as young as pre-K. I think that we need to push for legislation to really work with our young kids to understand misinformation. So push for legislation on media literacy required in K through 12 schools.
Okay.
There's a political thing I would tell people, which is very interesting. No Democratic state has implemented PAX GBG at a population level. Only red states. Think about that.
Okay. So
I'm not exactly sure why, but it's true.
Mhm. Well, Mary from Texas finds that really interesting. So
Keisha, I'd be interested in your perspective on the that question, just given your policy background and the work that you do with Castle. Any thoughts on this topic? Not just from the youth perspective, but more so from the adult perspective, given the narrative that develops in this area.
Sure, and I'm happy to share. So Castle, so as you all know, it's the Collaborative for Academic, Social, and Emotional Learning. And one of our most important efforts last year was establishing the Leading with SEL Coalition. It's a coalition comprised of 27 national organizations that are all working together in an effort to educate and raise awareness about what social emotional learning is and what social emotional learning is not. It's very, very important during these times to lead with the data. You all heard here today, the research is abundantly clear about the value and the benefits of social emotional learning and its impact to students and adults, and as well as public support for social emotional learning. I think we all look no further than the midterm election. What we saw on the ballot were Americans and across multiple states standing up and supporting public education and investments in public education, and specifically ballot measures around childcare, around supporting increased funding for meals in schools, and where there was specific attacks, and particularly wanting to see state legislators have more of a heavier hand when it comes to state departments of education. There was a specific ballot measure that was beat back in West Virginia. And so I would encourage everyone here to really follow the data and to understand that there is certainly a parent pundit gap when it comes to these issues. Over 80% of parents support some social and emotional learning and want it taught in schools. So I think it's very, very, very important that we lead with the data and that we talk about and lift up the importance of what the research says about these values for social emotional learning. And you all heard that here today with all of our excellent researchers.
Great closing remarks. Thank you so much, all of you. This has been a really terrific briefing. For the audience, we will be back in touch. For all those who registered, we will provide resources and the web link so that you can review or share the convening today. And feel free to ask us any questions as we go along. We'll try to have a brief out to you after this so that we can summarize some of what was discussed today. So thank you all for hanging in there, and I hope you have a good rest of your day.